Vasectomies are a great option for men and couples who want to manage their families. I may have seen too many TV shows that haven't taken the subject seriously enough, but it feels like vasectomies are perhaps misunderstood. My guest today is Dr. Riel Smith-Harrison, an assistant professor in the Division of Surgical Urology at VCU Health. So let's talk to Dr. Smith-Harrison about vasectomies and reversing them. This is Healthy with VCU Health. I'm Scott Webb. Doctor, thanks for being on today. I don't know if misunderstood is the right word, but what's involved with a vasectomy?
I'm not sure if it's about it being misunderstood, but more just kind of not knowing the details of the procedure. In short, so vasectomy is basically an outpatient procedure that guys have the option of using to kind of just really take control of kind of their reproductive needs and any desires to not have kids in the future. It's a 15-minute procedure. As I said, it's all outpatient, where basically we put the vas, or the two little tubes that take sperm from the testicle to the outside world, in discontinuity, or basically block them somehow. We kind of now use what we call a no-scalpel procedure, so the discomfort and pain is significantly less than kind of the olden days, we'll call it the 70s, when they were opening things up. But it's a relatively quick recovery, and after that, guys kind of have dealt with contraceptive management on their terms.
That's great, Doctor. Thanks for explaining things. How about the recovery time? How quickly can people get back to their daily lives?
So obviously it's going to be a little bit different if you're working on power lines and if you sit at a desk. But in general, what I tell guys is obviously that first day you're going to take it really, really easy. And we say about no heavy lifting for about a week. That's basically nothing more than kind of 10 pounds or a jug of milk. And then no heavy exercise like going to the gym, etc., for about 2 weeks. And that's just to really limit the likelihood of one of the post-operative risks, which is a hematoma or a blood clot in the scrotum. So obviously nobody wants that.
That's not too bad. It's just a couple of weeks at the most, right? How long before a vasectomy becomes a viable form of contraception? Because I'm assuming that's really the only reason someone does this, right?
After the vasectomy, it doesn't obviously work immediately. You still got swimmers in the tubes, and we have to flush them out. So what we do is we bring you back at 2 to 3 months for a semen analysis to make sure you're in the clear, which obviously most guys are. And once we get that result back, you're good to go.
And doctor, do you find that your patients are just really relieved after the surgery?
Oh, yeah, absolutely. A lot of the time, it's not just the gentleman who's being affected, but also his partner who's also worried about this. So it's just kind of them having better control of kind of how they want to manage their lives in future, previous children, future children, their family in general.
So, doctor, what kind of counseling is available to men and couples as they begin to think about managing their families?
Most of the time, it's just the male coming in, and we sit down, do an exam. I kind of go through the whole procedure in detail and kind of leave it up to them. There's obviously no pressure on my end to do the vasectomy. A lot of guys come in 6-8 months later saying, hey, I'm finally ready. And a lot of times the partner is there as well, because they have questions as well. But yeah, it's usually just a good, honest conversation to make sure that that's exactly what they want to do.
And I'm sure, like with any surgery, insurance is a factor. Are vasectomies covered by insurance?
I wish insurance was standard. It's rare that they're not covered in some capacity at all. Some insurances have kind of pre-prescribed, kind of dictating where it can be done, when it can be done, etc. For most patients, we can find a way to get it done.
Okay, so at least some coverage. We assume that a vasectomy is kind of irreversible, but I don't think that's the case anymore, correct?
Correct. So about 20% of guys, for whatever reason, come back at least asking about what the options are for having a biological child after a vasectomy. So while you have the vasectomy, obviously your testes are still working. The factory's still on, and it's just blocked. So as I said, about 20% of guys come back asking what their options are. And the main one for most guys is basically a vasectomy reversal.
And I'm assuming then that the same thing applies, for the initial surgery, the original vasectomy with reversals, same sort of prep time, recovery time, downtime, if you will.
So the reversal tends to be a little more involved. Instead of it being a 15-minute procedure, it's more like a 2 to 4 hour microsurgery. It's a lot easier to block something than to kind of open it up. So we're basically trying to take a hollow piece of spaghetti and sew it back together with suture that's finer than your hair. So a little more involved.
That does sound a little more involved. And are there more risks involved with the reversal?
Not really more. The risks tend to be about the same. The reversal does have kind of a true incision, so it's more uncomfortable, but again, not terrible.
That's all great information. What else can we tell people about the surgery, the reversal, and specifically the work being done at VCU Health by you and others?
Yeah, so in terms of a vasectomy, so easy way for a guy and his partner as well to really kind of take control of family management. In terms of reversals, I think there's this misconception that success rates are really low If we can do vas to vas, if you look at data, the success rate of getting sperm back in the ejaculate is about 95%. So actually pretty good. Some instances where it's a little bit more complicated of a surgery, where that drops down to about 65-70%, but still, a reconstructive surgery, pretty good odds for a good result.
Yeah, I would say so. I mean, even at the worst case, 65%, that's still pretty good. Well, Doctor, thanks so much for your time and your insight today. Really fascinating topic. Thank you. To hear more about how you can take control of your health, listen to other episodes of Healthy with VCU Health at vcuhealth.org/podcast. This is Healthy with VCU Health. I'm Scott Webb. Thanks for listening.